what are the parameters to look at when you're choosing a college for MBBS and for BDS?
First and foremost thing is your NEET score. And because the college will be allotted as per your NEET score.
A patient also has to trust the doctors, right? So it's going to take time over the course of years. And we have to look at it from the patient side also.
Yes. See, consider the patient as a layman.
But that brings me to the point that each individual has their own personality. And at that very sensitive age of 17 and 18, you're trying to copy somebody else just because they are choosing a certain college or they are choosing a particular course. I want to do that. But you don't have the maturity to think that what is good for me. So how can students open up their minds and understand that, this is not a short game. This is your entire life. And your life depends on what decision you make today. And how do you go about going through this process? It's a mentally taxing process, right? So what kind of things can help a student at this very sensitive juncture?
This is a very good question, Palak. And to be very honest, there is no definite answer to it.
Okay.
Even if I tell something, it will be a view from my side. And the best way to find an answer to this question is you have to talk to people. You have to talk and talk. Means you have to discuss with one person, two person, three person. And you have to see many things because the grass is always greener on the other side. I might not be liking my profession, but I am doing very well. You can come and you can go to a dentist or a doctor nearby. You can see him coming in a Mercedes, having a very nice house. And ask, he said, no, nothing is there. From morning to night, I am working. Whenever I have calls, I have to come. So what is good about it, right? You can see a dentist doing the same job. No, it has become saturated now. क्या है इसमें? You will get confused कि इतना अच्छा कर रहा है लेकिन फिर भी इससे not satisfied. So the level of satisfaction is a very big question. It's a perspective. You have to talk, discuss, take a decision by yourself. You have to find out the right answer for yourself. There is no other way. And I will rather say, don't follow what somebody else is telling. Because grass is always greener on the other side. मेरे को जो अच्छा लग रहा है वो हो सकता है कि दूसरा को अच्छा ना लगे.
But it's all a mental game at the end.
Yeah.
I've seen people in the peer pressure pay 20 lakhs, 25 lakhs to do MBBS.
Yes.
And 4 years, 5 years down the line, they're all financially is one thing. But because they've spent so much once, now the entire guilt trip that comes when you know that chalo maximum I'll earn is 80,000, 1 lakh rupees a month. मैं कितने सालों के बाद जाके वो पैसा recover करूँ?
More than that, if somebody gets a wrong job, because many hospitals, they give a very basic job to the MBBS graduates.
Right.
So the guilt is more on that side because he is neither receiving the professional satisfaction. Apart from the money, ठीक है किसी का होता है कि we have so much of, we are well to do, we can pay that much of fees, that's okay. But just imagine for somebody who has done this by compromising many things, and at the same time after completion of his course, he is not able to get the job satisfaction.
Job satisfaction.
Because you have spent in crore. Yeah. I'm talking about the private colleges. The same guilt is not there in dentistry because the return, the amount of which you have invested could be on the lower side as well. Correct. So that's okay. So
the average salary not salary. The average fees for a BDS will start at around what cost?
Including food and hostel, I would rather say that you can get dental colleges for 9 lakh rupees also, means 9 lakh rupees for the entire course. Yeah. So you can say 2.25 lakh rupees including food and hostel per annum. And it can go up to 10 lakh rupees per annum. The finest example is Savita.
Right. So, say for example, my parents can afford it. So I can, and my marks are good enough to get a college with 2.5 lakh rupees and a college with 10 lakh rupees. Now, what are the deciding factors on my table to decide whether I should go to the 10 lakh college or the 2 lakh college?
Visit both the colleges and find the difference.
Then I will select the 10 lakh college only.
No, it is not like that. If you can find difference in infrastructure, you can find a difference in technologies. Yes, of course, you will be one step ahead. You will be one step ahead. But is it actually making that much of difference in your life? That is the correct question.
Does it?
Sorry?
It does, right? It will make a difference.
It will make a difference. But the thing is it making that much of a difference?
So if it is 2.5 and 4, it's 4x. Is it going to make 4x of a difference in the future?
You cannot say. You cannot say like that. I have seen students who have done dentistry from a very relatively small institutes, and they are doing relatively very well than the students who have done from top end institutes.
So then it doesn't matter on the institute at all.
No. It matters on you. It is see, you need to have the confidence, doctor. You should be able to develop that kind of confidence in you that yes, I can do the work. At the end of the day, what does it matter? How much work you know and how good you are at your work, right? And you can develop skills over a period of time. It is not right to say that if you are passing from a college whose fees is 9 lakh or 10 lakh rupees per annum, you have got a God's gift to do every job, right? So that skill will not come again apparently all at an instance. Yes, you will be one step ahead because you might have seen those techniques, those instruments which you cannot see in those colleges. But then you need to have that confidence. ठीक है, हम लोग इसके बाद में कर लेंगे. हम लोग किसी के अंडर काम करेंगे. आप 30 लाख कम भी तो दे रहे हो. आप 1 साल अगर किसी अच्छे डॉक्टर के अंदर में आप काम भी कर लिए तो